The production of this program is made possible thanks to the support of the following and viewers like you. Outdated policy decisions made more than a third of a century ago helped create our expensive, ineffective, and inequitable Medicare scheme, says Dr. Brian Day. For 30 years, Dr. Day has been challenging Canada's healthcare system, prodding it to be better, to meet the needs of patients. In 1996, Dr. Day took a bold leap, one born out of frustration with the shortcomings of the healthcare system. He opened the Cambie Surgery Centre, a private surgical clinic that has grown to perform up to 5,000 procedures a year. For that, Dr. Day says, despite reducing healthcare costs and waiting lists, we became a target of the government of British Columbia. The BC government set out to shut us down. The government's action resulted in a 13-year legal battle, a battle Dr. Day lost, a battle he outlines in his new book, My Fight for Canadian Healthcare, a journey, he says, that takes the readers through a failing system that has deviated from its intended purpose, ensnaring patients in long cycles of waiting and suffering. I invited Dr. Brian Day to join me for a conversation that matters about our ailing healthcare system and where do we go from here. Dr. Day, welcome.
Thank you.
I watched your case with great interest and was absolutely astounded that it ended the way that it did, that you weren't given the hearing that the Chihuly case in Quebec received, and yet you were basically asking for the same thing.
Yes, I mean, essentially, the BC Appeal Court, where we lost, they came out with some astounding statements, such as, you know, the system is, you know, as you know, I don't like the word system because that implies some kind of organization. The system is purposefully designed to ration access to healthcare based on fiscal sustainability. And they also ruled that patients are suffering and dying based on wait lists, and that it was a government policy. They also said that it's not our goal or our position to opine on what would be a better system. That's up to the governments and politicians to do. So basically I think they were deferring to the Supreme Court of Canada. They didn't want to make the decision. And, you know, in the Chihuly case that you mentioned for Quebec, they also lost at the appeal court level.
But they were heard at the Supreme Court level.
Yes, and so numerous judges, and I mean a lot of judges that I've spoken to since, say they are ashamed of the Supreme Court of Canada for being too afraid to take on this question. And of course, it's ludicrous that some people in Canada living in Quebec have been granted rights by the highest court that the rest of the country doesn't have. And that just reminds me of another weird reality, is that if you cross the provincial border, you're in a different world as far as the health system. So in British Columbia, you know, quite a few months ago now, but I operated on 5 Albertans. On the same day, an Alberta surgeon was operating on 6 British Columbians. Because once you cross the provincial border, you're exempt from the laws of that province. And I kind of joke saying, how would you feel if an Albertan could come to BC and drive through red traffic lights and speed at 200 kilometers in a 50K zone because the laws don't apply to them? It makes no sense to me.
It doesn't make any sense to me either. You talked about the way the system is set up. It's not set up to accommodate a maximum number of people. The more people they accept, the less money they have. The model is so skewed.
Well, we're the only OECD country out of 32 countries that of those that have universal care. We're the only one that funds our hospitals on global budget or block funding, meaning the hospital gets a lump sum of money every fiscal year, And therefore, every patient that goes to an emergency department, every patient that goes in for surgery is using up the hospital's money.
So they're depleting what they have in the bank account.
Yes, and so if you or I even, I mean, I don't blame the chief financial officer, but if you or I were the chief financial officer and our main job was to stay within budget, the last thing we would want in our hospital is patients, because they use up our money. That's bizarre, and it's unique to Canada.
The production of this program is made possible thanks to the support of the following and viewers like you. You have cited the model in the UK as saying it's literally turned on the head of what we do. And how is it that works from a financial perspective in a way that we're not even looking at embracing?
Well, the UK is a model that we took many of their principles in the 60s and enacted the first universal system. And the truth is, back then it worked. But we have been frozen in time. We have not moved along with reality and the reality of a health system that now offers interventions that just weren't even thought of then, like robotic surgery, gene therapy, stem cell therapy, expensive drugs, transplants, and so on. These were not done in the 60s. Even joint replacements weren't done in the early 60s. So healthcare costs are rising, and we haven't kept pace with that. We haven't planned for it. The founders of Medicare, even the big names like Justice Emmett Hall and Tommy Douglas, never intended that it would be a government monopoly. They always felt that we had to look after the lower income groups, and therefore if you were wealthier, you could afford to pay a bit. That has been, and I think it's been, mostly driven by a desire for votes, that wealthy people are getting benefits and low-income groups are suffering. So the most astounding statistic that's out there for me is that Canada, of developed countries that offer universal care, we are the last in terms of looking after low-income groups. So in Canada, we're the least equitable health system of all developed countries that offer universal health care.
Isn't that ironic? Because the moment you start talking about saying, okay, how can we improve the healthcare system, you get attacked for saying, well, you want to destroy it and therefore limit access to the system for the very people who aren't getting it right now.
Yes, I mean, we know, let's face it, wealthy people have never suffered, will never suffer. They'll simply go to the United States. So it's not about wealth, it's about an equitable health system that looks after everyone. And, people raise the thing, oh, well, if you legalize private insurance, then only the wealthy will afford it. Well, that is not true, because companies like Germany, Holland, even Australia, they subsidize private health premiums for low-income groups. So I actually lived and worked in Switzerland for a while after I qualified as a trainee, but in Switzerland and in other countries, low-income groups have their private insurance subsidized or paid for by the state, and therefore they get the same private rooms and excellent healthcare in a timely manner that the wealthy get. Here, as you and I both know, a person of influence doesn't wait for healthcare. A premier doesn't wait. A minister doesn't wait. A politician doesn't wait. And wealthy Canadians don't wait. And that's why the data, even Statistics Canada data, shows that we are the worst performer when it comes to low-income groups. So there is nothing to stop the government paying private insurance premiums in Canada. Nothing.
The production of this program is made possible thanks to the support of the following and viewers like you. So let's go back to the mid-1990s. You're practicing What was it? Because you talk about, you go, okay, I am frustrated. What was it that made you say, I'm going to go out and I'm actually going to relieve some of the burden on the system by opening a clinic that can take people off the waiting list and give them healthcare in a timely manner? And in doing so, create opportunities for others to get onto those waiting lists.
Yes, well, the precipitating factor was the rationing. So my colleagues and I, who were surgeons working in the public system, progressively, as part of the rationing, had our operating time cut back from, in my case, 22 hours to 5 hours a week. And that colleagues were similar. And yet I had 400 patients waiting to get into hospital. So that was an impossible situation. And so we essentially took a position that, you know, if the hospital won't let us bring our patients into their hospital, let's build our own hospital and take the patients there. And the biggest target, a big target was injured workers, because we were, you know, injured workers were waiting a long time, they were deteriorating, and we knew Workers' Compensation Board could send patients anywhere they liked.
Because they had the authority to do that.
Well, the Workers' Compensation Board, a lot of people don't realize this, is a private health insurance scheme funded not by government. I mean, the government exert control over it, but it's funded by employers.
Right.
And it's a private insurance scheme, and that's what one of the directors testified in our trial, that we are a private insurance company and we want patients to be treated quickly because we're responsible for their long-term health costs if they're not treated quickly, and we know that delaying treatment causes more problems in the long run. And you know, that is, to me, the problem with governments running the system. Governments operate in 3-year financial cycles to the next election. They don't plan long term. They don't care. A government today does not want a government 20 years from now to look good financially, so they don't care. And we know that when I was president of the Canadian Medical Association, we did a study showing that for just 4 procedures out of the thousands that exist, the economic cost of keeping people waiting a year in 4 provinces was $14.8 billion, the economic cost alone. So, but that doesn't show in the near term for a government. And you know, these are all reasons why governments shouldn't be solely in control without some oversight.
So what I find interesting is in the mid-1990s, when you're opening the Cambie Surgery Centre, this is in the midst of an NDP government led by Premier Mike Harcourt. And I would have expected that you would have had tremendous resistance to that from an ideological perspective, and yet you were granted permission to open the centre.
Well, you know, Mike was my doubles partner in tennis. So, but Mike was not like other NDP premiers because he understood that injured workers were suffering, and you know, they wanted injured workers to get treatment. But the other thing that that Mike Harcourt believed in, which is different from the NDP governments of today, and he said this to me within the last few years, he says, you know, Brian, our NDP government wasn't like this NDP government because we recognized that we needed wealth in order to treat poverty. And this government is killing the wealth of this province, and that's going to kill the resources that treat poverty. And I think that's a very profound statement. So yes, we were, you know, we opened smack in the middle of a 10-year rule of an NDP government, and they didn't exactly support us in public, but they left us alone, and they basically understood that the system wasn't working. They saw the beginning of the end of patients. Patients were suffering on long-term wait lists, and they didn't have the money to fund the system adequately. So other countries have learned from this. I mean, there are countries, I think, I use the sports analogy that, if you were the manager of a sports team, a soccer team or a hockey team, and there was a league of 10 teams, and you were at the bottom, and the team at the top was spending less than, the top 3 teams were spending less than you are, but was the top 3 and you were bottom, wouldn't you kind of look at what they're doing? And so I say, go and look at Germany. I mean, in Germany, or Switzerland or Holland, in Germany, 90% of the public are covered by the public health insurance scheme, universal care, which, by the way, covers things that we don't cover, like ambulances and medications and physio and dentistry.
It covers dental as well?
Yes. So
which we don't cover.
We don't cover any of those things.
No.
I mean, you get hit by a car and are lying there with a broken leg in Vancouver or Canada, and you get a bill for the ambulance because it's private. It makes no sense. Not considered necessary. You're supposed to get on a wheelchair and get into the hospital yourself. But in Germany, 90% of the public have public health insurance, 10% have private. And I asked a recent German visiting orthopedic surgeon, how long do you wait for a hip or knee replacement in the public system? His answer was, it's a long time compared to the private. I said, well, how long? He says, at least 3 or 4 weeks. And he says, but it's only 1 week or 2 weeks in the private system. That's what happens when you have competition. The governments fear the private sector because it will make the public system look bad. But when you don't know about if there's any other alternative, it seems you don't know. I mean, I think perhaps the greatest and most significant thing that people, the public needs to understand is there are almost 200 countries on this planet. There is only one with jurisdictions that make private health insurance illegal, and we're in that country. That to me alone says it all.
The production of this program is made possible thanks to the support of the following and viewers like you. Okay, so where I'm confused is we take a look at the system. Mike Harcourt appreciates that you can at least give some relief, even if you can't address all those other issues. But then along comes the government of Gordon Campbell, which turns its sights on you and basically says you're not allowed to do this.
Well, Gordon Campbell actually didn't do that. He happened, he was away in China, I believe, when that happened, and some people in the bureaucracy kind of put that through the laws that targeted us. But then he didn't act on them. And to give Gordon Campbell his dues, the doctor shortage today was created by the NDP government that preceded him. They had this commission that concluded the costs of rising healthcare were due to too many nurses and too many doctors. The solution, therefore, based on the Royal Commission of Justice Seaton, was to cut back medical school intake and close nursing schools. They closed 1,600 nursing schools in the 90s. 1,600 nursing positions they cut back in the 90s. And then guess what? We now have a shortage of doctors and nurses. The government created that shortage. And to give Campbell his due, he doubled the number of students in the medical school to counter that. He raised the number of nursing positions by, I think, 60%. So he tried to undo what had happened previously, and the law he brought in never received royal assent.
Not in his government.
In his government, but the NDP government later gave it royal assent.
Premier Horgan.
Yes. So, well, I don't know which premier, but it was an NDP government that gave it royal assent. And to me, years ago, I wrote an article in the Vancouver Sun called "The Hypocritical Oath." To me, what's awful about this whole topic is the very people fighting for the status quo aren't subjected to its constraints. So judges, MPs, federal employees, even prisoners are exempt. But worst of all, during our constitutional trial, the defendant was the Office of the Attorney General of British Columbia. They were sending us patients privately. So the instigator of the whole thing was the BC Nurses Union. They were sending us patients. I have checks from the BC Nurses Union. I kept the old checks in case there's ever a confrontation. And I said this in evidence at the trial, and no one wanted to cross-examine me on it, because then out would come more and more information.
So have you given up now on fighting to change?
Well, I know
you wrote the book, but
yeah,
at what point do you go?
So I haven't given up, because we owe it to the next generation. And it's not just a healthcare thing. This is an economic thing. I mean, we are, last I checked, Canada is now $1.3 trillion in debt. We are mortgaging the younger generation. I have 6 kids, and I'm concerned about that. And I have 6 grandchildren. I'm concerned about them, and I'm probably going to be a lot more grandchildren in the future. We've got to fight for them, and this is the healthcare system is bankrupting us right now, because we're not letting wealthy people like Conrad Black doesn't need free healthcare. Let him buy a private policy and use his taxes, which he pays a lot of, to fund private insurance for low-income groups. If that's when that eliminates the concern. And we just have to look. If you look at education, no one is suggesting we close all the independent schools, the religious schools, the private schools, and no one is suggesting that the education system in Canada is costing too much or is degenerating. And guess what? There is no federal Ministry of Education. There is no federal Minister of Health.
So what do average people have to do to help maybe instigate changes?
I think the average person needs to voice their concerns to their elected officials. As the BC Appeal Court said, it's up to the politicians. And, I disagreed with them, because I don't think politicians should be allowed to, cause patients to suffer and die. 35,000 Canadians a year die on public wait lists. I think that's unacceptable. To get both the courts and governments have endorsed at least 35,000 deaths a year. It might be double that. But that's based on what the 35,000 figure is based on government release figures, and we happen to know governments don't always release the true figures.
We have to continue to speak up. Well, thank you for coming in and letting us know that you've written this book and that there is a lot of work yet to be done.
Thanks, Sue.